One thing that I like all my patients to know is I'm going to give you the options and the pros and cons of surgical and non-surgical treatment, and I'm going to empower the patient to make those decisions on their own. And then of course, anytime we can avoid surgery and we can treat a problem with conservative methods, we always try to do that first. I like to get to know my patients. I like them to know me. I like to talk about where they're coming from, the problems that they have, the symptoms they describe. And then another big part that's important to me is talking about their goals, because what a patient is trying to get back to is a big deal. Some patients' goals are much different than others. My favorite thing about helping patients recover is seeing them get parts of their life back that they lost. And so a lot of people come to me saying, I used to be able to hike, I used to be able to ski, I used to be able to play tennis or pickleball, and I can't do that anymore. And when we can find a way to help those patients get back to those activities, they are very grateful, and it's super rewarding for me. Outside of medicine, some of the things that are important to me that I enjoy doing are hanging out with my wife and our 2 dogs. I'm from Minneapolis, so Minnesota sports, including the Vikings and Timberwolves, and spending time outdoors, golfing, hiking, skiing in the winter, and then my shoe collection as well. A lot of us wear scrubs every day, and scrubs look the same. So finding ways to express yourself is nice, and in this case, wearing shoes is my way of doing that. And also, of course, as a surgeon, I'm standing all the time. So you gotta have good footwear, something supportive and comfortable. My team and I spend a lot of time reassuring patients that we are gonna be with them every step of the way. From the pre-op appointment to the day of surgery to the follow-up visits, I try to provide access to both myself and my staff so that patients never feel like they're alone or that they don't know the next step. And then we make sure that patients are well taken care of. They have everything they need at home after surgery. They have their family and friends involved. And I always encourage patients to bring their family and friends to their appointments so that you have multiple people listening to the instructions and the plan so that stuff doesn't fall through the cracks. So I just think good communication and making sure the patient feels like you're on their team are very good ways to support their recovery.